That was brilliant. And when the truth wasn't scary enough for our public health experts, they started lying. They started exaggerating the deaths. They started conflating all of those numbers. Many of the deaths, were that problem of some people died with COVID-19, some people died of COVID-19. The majority, and the CDC has kind of exposed this, is the majority of people that died, they died with COVID-19. Many of our, of our elderly population that were lost were lost in the last years of their life. They were very susceptible to any virus. Of influenza virus will take them out. Rhinovirus, even the regular coronaviruses. Those are the kind of infectious diseases that will take an 85, an 87, a 90-year-old out that has, been holed up in a nursing home where they're not getting sun, they're not eating the best foods, they're not getting, their sustenance is simply about 16 to 18 pharmaceutical drugs for the most part. That's really how we're mistreating our elderly. But the truth was just not scary enough for the people behind much of the messaging here. So they had to start exaggerating the deaths. And then when the deaths had really diminished to almost nothing, where we were below what's called the excess mortality rate for the population, then they had to switch the narrative to the case-demic. They had to create a scary case-demic. So the number of cases that were created with a prone to error, high false positive RT-PCR test. This PCR test is not only does it have a naturally high false positive rate, but the way they're amplifying it, the cycle thresholds that they're running it to 40 to 45 amplification processes, is creating absolute irrelevant data for us now. Most of the cases are irrelevant. Anything over 34 amplification cycles, what we call the CT number, is irrelevant. That's beyond 34. You don't have an infectious SARS-CoV-2 viral infection. You just have, we're detecting possibly the remnant particles, the little fragment that the RT-PCR is identified to, that could have resulted from a cold 2 years ago or 6 months or 9 months ago. So the case-demic is another mistake that we've made here in the COVID-19 pandemic. We are now calling it's the first time that we've ever called a pandemic based on the presence of this little viral particle. Previously, a case was a case of infection that produced symptoms. Most of the cases that are being identified out there are asymptomatic. They have no symptoms. They don't even know they have it. But because they worked at American Airlines or some other big place, and they were all lined up to go get their test, and lo and behold, they had a cold a year ago and they still have viral particles and they get a positive test. That's irrelevant to what we're doing, and it certainly is not the data from which we should be making such major decisions that are destroying the health of our economies, destroying the health of our children, masking children in schools, masking the population. These are wrong-minded anti-science policies that are based on fraudulent information like case-demic.
Something that I wanted to even add to that, because it actually brought another thought to mind. So my dad was a preacher. He was a bishop. He died last December, 89 years old, of complications from a stroke. He had a tremendous life. He lived a full life, and he was ready to go. He done what he came to this earth to do, and that was not even a year ago. And I'm real grateful that he's not here now, because for one, had he died, 2 months ago, 3 months ago, we all know what they would have put on his death certificate. They would have said he died of COVID, as they are doing with everybody. That level of dishonesty is disgusting. It's disgusting. All across the country, they are putting COVID on people's death certificates. Some people dying in a car accident, and they put COVID. And then they use these words, and no one knows words quite like me. I've written over 200 books. And so they'll use not just COVID anymore. Now it's COVID related. I mean, that's such a manipulation of words that it really deceives the masses. And under any other circumstance, under any other type of government, that would, almost be tantamount to some type of treasonous activity for misleading the people. But now it seems to be legal and it seems to be applauded. Even when you talk about the school systems, our schools right now are a wreck. They're horrible. I know. I'm in the education field. The children are going to school, and despite this hybrid model or even the Zoom model, the kids don't want to learn. They're not enthusiastic about learning. You've got, thousands and thousands of teachers that are acting like the kids are germs. They don't want to go to school because they say they're going to get infected by these kids. If one child test positive for COVID, they shut the entire school down. This is absolute absurdity. It's ridiculous. At Amazon.com, they said that there were thousands that tested positive for COVID. How come Amazon.com doesn't shut down its business? Because I think that would be, the responsible thing to do in light of the fact that they are shutting down entire schools all around the country. And so there's a stretching. There's a stretching of this narrative that has gone way too far. My problem is when people don't know that they've gone too far. You understand what I mean? It's like they've gone so far. When will people of conviction raise up? When will a mayor say, I'm not doing this no more, this is stupid, or a superintendent of schools, or a governor? When will we see a real leader emerge? Because I completely believe that much of what's happening today is not showing us that, there's this big boogeyman disease that's running around, trying to molest somebody. No, this what's really being seen here is that there is a lack of leadership all around our country, because I can't imagine that out of 50 states with 50 governors, with a half dozen commonwealths and territories of the United States, and thousands of mayors all over the United States, that there's not a group of people that can come together and say, we're not going to be the ones that's going to be continuing this narrative, because not only does it not make sense, we know it's a lie. It's completely laughable for us to even buy into this. And then everyone that's saying listen, if you tell somebody that that a cure for COVID is by having a not compromised immune system, people laugh at you. And then many people say, well, I'm going to wait until the vaccine comes out. And when the vaccine comes out, I'm going to be safe. An untested vaccine on humans. You understand? They've not done a series of batteries to prove that this overnight miracle, savior vaccine is going to be safe. But yet you have an overwhelming majority of the population that thinks that this might be a good idea. What's wrong with us that we can't see the handwriting in blood clearly written on the wall? We really have to start to revisit our own mentality and see what happened with Americans, what happened with the dumbing down of education, that we are at a point now where we can no longer think for ourselves. We literally don't think anymore. We don't think. We have governors that are thinking for us. We have mayors that are thinking for us, school superintendents that are thinking for us. And it's a sad shame that we cannot think for ourselves. And the reason why we can't think for ourselves, because like with anything, whether it's baseball or football or basketball, if you get good at that sport, is because you practice. And that's just one sport that we got an F in practicing: thinking.